looks like you have finally awoken. Yes, you are here in Dream City Clinic, and you are resting in one of the medical beds here in the Dream City Clinic Health Line. Yes, you are here because you are feeling a bit under the weather, so we asked you to stay just a bit overnight to check your health. Yes, and I'm here to perform a late at night medical exam to make sure your health is okay. Perfect. It's a pleasure to meet you. I'm Nurse Luna. Yes, I'm going to take a seat now and I'm going to look at your documents. So, I was reading your medical files and I was just checking to make sure everything was aligned. And if I look at your paperwork here, you did say you arrived and you were very tired and you felt just a bit overwhelmed. Is that true? Yes. And you said that you were experiencing not the best sleep for the past couple of weeks. Is that so? Yes. And do you know if you've had anything like any type of sicknesses such as a fever, perhaps a sore throat, headaches, etc.? Okay, I'll have to write that down. First, I'm going to just get some gloves on, okay? But your documents are right here. No worries. What we're going to do is something called a head-to-toe exam. And what that entails is a very relaxing medical procedure where we just check your health from top to bottom. That's it. Especially if you're staying overnight with us, we make sure that your health is our top priority. Yes. Again, I am Nurse Luna. I will be your nurse for the evening and as well the morning. So, could you let me know when your sleep started to not be the best? Okay, I understand. And when did you start feeling a bit overwhelmed? When did that start? For a while, but then it just got a bit more. I understand. What I'm going to do first is I'm going to get your vitals. And we always start with checking your temperature. Is that okay with you? Okay. I'm going to put my hand right there on your face if that's okay with you. And I'm just going to check your temperature with this little tool we just put on the forehead, okay? Okay. Just relax, okay? Okay. And one more time. Good. Marvelous. It looks like your temperature is perfect. I'm going to quickly write that down into our book over here. I'm going to write down very good temperature. Marvelous. And what I'm going to do next is I'm going to take a quick look at your blood pressure. I have a tool here that we use to just put around your arm, if that's okay with you. Okay. So I'm going to ask you to relax, okay? And which arm do you prefer? Perfect. We'll use this arm. I'm just going to put this around your arm now. Let me know if it bothers you. Good. Okay. And I'm going to listen to one part of this with my stethoscope. And I'm going to just add a bit of air. Okay? Good. Just relax. Perfect. Now let me just get the reading of that off. And it does look like you were at around 180 over 75, which is perfect for the gauge. Good. Let me remove that from your arm now, okay? Good. the shoulder blades to get your accurate heart rate, okay? Good. So I'm going to just put this in my ear. Okay, I'm going to put this right there on the sides of your shoulders, okay? Just relax and breathe in. Good. Breathe in. Good. Perfect. And breathe out. Good. Perfect. Other side now. Breathe in. Good. And breathe out. Perfect. Now I'm going to test it right on your back, okay? Breathe in. Good. And breathe out. Marvelous. Good. You can relax now, okay? I'm going to put all these tools aside. Apologies if that was a bit cold. Now, what I do is we're going to start the head-to-toe exam. I'm first going to start by looking at your scalp. And I'm going to ask you just to relax right there in the medical bed, okay? Don't want to move you, especially if you're tired or you're feeling not the best. Yes. Would you like any other pillows or blankets in the meantime? You're good. Marvelous. Perfect. Now that I've put all those tools aside, I'm going to begin the head-to-toe exam now. We're first going to start with your head. Eyes, ears, nose, mouth, and scalp. Okay? And I have a pen light here. It can be quite bright. Let me know if it does bother you. And I'm going to be covering one of each side of your eye with a little tool. All I want you to do is let me know if you're able to see the light. Does that sound good? Marvelous. I'm going to put this right over your eye, okay? And let me know, are you able to see a light? Perfect. And what side is the light on? Good. Other eye now. I'm going to put this over your eye, okay? And covering your eye. And let me know, are you able to see the light? Good. And what side is it on? Perfect. Good. And look back at me. Good. And can you follow this little cat right there? Follow that with your eyes. Good. Perfect. And up. And below. Marvelous. Now follow the cat light, but try not to move your head. I'm going to just hold your chin. Just use your eyes to follow it, okay? And following it up. Following it to the opposite side, to the right. Following it below. And to the opposite side. And back to the center. Perfect. Looks like your eyes are functioning well. That's good. I'm going to use the pen light again. I'm going to ask you just to relax, and I want you to look at the sand over here that's on my left. Good. I'm going to ask you to let me know how many fingers I'm holding up, okay? So I'm going to shine the light into your opposite eye, but let me know how many fingers I'm holding up, okay? So relax. Good. And how many fingers am I holding up? 5. Perfect. How many fingers am I holding up now? 3. Perfect. And now 1. Marvelous. Perfect. We're going to do the same onto the opposite eye, okay? Good. So, right there. And how many fingers am I holding up now with the opposite hand? 3. Perfect. And how many now? 1. Marvelous. And how many now? 5. Perfect. Good. I'm going to get a bit close to you now. I do apologize. But I'm just going to check how your pupils dilate as I put the light closer to you, okay? I want you just to sit back and relax. If you could stare right there at the Snellen's chart at the wall, that would be perfect. Just look at that and completely ignore the light, okay? I'm just going to get a bit close to you. I'm going to just carefully side of the pen, and your eye was perfect at around 8 to 9 millimeters, which is a perfect reaction if light is that close to your eyes. Yes, marvelous. Next, what I'm going to ask you to do is, if you could just say ah. I'm just going to check your teeth. Okay, good. I'm going to ask you just to say ah very carefully. Okay, say ah. Perfect. Okay, looks like you do have all your teeth. Congratulations. And it does look like you do still have tonsils, don't you? Yes. Okay. And I do notice that you are taking proper care of your teeth, which is good. And I'm going to ask you carefully, are you able to put your tongue to the top of your mouth? Good, try that for me. Good, and relaxed. Marvelous. Okay, you can relax now. That's the perfect thing I'm looking for. I'm going to put my hands right here below the chin because we are going to be feeling the lymph nodes, if that's okay with you. Good. I'm going to be checking for sensitivity or if they are swollen. So let me know if that bothers you. Okay, good. Put a little bit of pressure right there. Are you okay? Good. And I do see that they are just a little bit swollen. Do you feel that? Yeah. Especially if you're not getting the best sleep. Your body overreacts in ways that makes it so that you will get your sleep. So, okay, and you can relax now. Good, just relax. You feeling okay? Good, so I'm going to quickly write that down in your notebook that you are experiencing just a bit of lymph node sensitivity, and that's normal. Good. Next, I'm going to check your ears. And this is always the fun part. So we're going to be using an otoscope on you. I just got a new one, so you get to use the new one. And this tool allows me to see inside your ears. And what we are going to do is replace the lid. I'm going to get you a new lid. Okay. I'm going to turn the light on, you'll be able to see it. And I'm going to be taking a look inside your ears, okay? Okay. So, I'm going to start on one of these ears, okay? Okay, I just want you to relax. Good, just going to take a look. Do you hear that? Yeah, it just looks like a bit of sensitivity and some wax build-up, which is quite normal. Do you listen to loud music, or are you someone who wears like headphones or earpods before you go to bed? I do not recommend it. I would say just relax and try not to wear earphones so much. I'm going to take a look again, okay? Okay, now I'm going to look at the other side. Let's see if they are the same. Just relax, okay? Good, I'm going to be taking a quick look. And can you hear that? Good. So, it looks like both of your ears are working properly. It does seem that they are a bit irritated, so again I'm going to let you know, don't wear headphones so long and don't fall asleep with headphones on. And we're going to be checking your nose now. It might make you sneeze, just relax. Are you someone who has allergies or things like that? Yeah? Well, I'm going to take a look, okay? I'm going to look right into your sinuses. Okay, I see. Perfect. To the other one, just relax. Okay. Perfect. I did not see any sinus problems, so it looks like you're doing well. Good. What I am going to let you use is a bit of an allergy solution, because it did look like you were just a bit allergic there. I'm going to ask you just to breathe in and breathe out, okay? I'm going to apply a solution in 3, 2, 1. Breathe in. Good. Other side. 3, 2, 1. Good. Perfect. I'm going to let that rest. We're going to redo that for the nose. 3, 2, 1. Good. And 3, 2, 1. Perfect. And what this is, it's a saline solution to just help clean the nose. It's going to help you breathe and stuff. Yes. It's to just stop any type of stuffiness that you can get, especially in hospital. And it'll help you just breathe and relax. Okay. And next, what I'm going to be doing is I'm going to be looking at your scalp. And what we're going to be looking for is contact dermatitis and or lice. Yes, and perfect. So we're going to begin just looking for lice now, okay? Good. Just relax. A lot of people find this part the most relaxing one. It's going to be very fast. I'm going to carefully just brush through your hair like this. Okay. I'm going to be working a bit closer now, I apologise. Just going to... Okay. Getting my tool again. Okay, and on the other side. Okay. Okay. Checking the back of the scalp now. Okay, I'm going to get just a little bit of a comb. Just going to right to there. Perfect. So, no sense of dermatitis, no sense of lice. It was perfect. Good. Looks like you're keeping your health up very good. Yes. And now we're going to move on to the musculature and movement of your body. So I always use this tool. First we're going to assess the face, then the shoulders, and then the rest of the ligaments that move, such as your hands, knees, and elbows. Perfect. I'm just going to carefully tap on your forehead to see if your body reacts, okay? Good. Just relax and sit still. I'm going to see if you make a reaction. Perfect. Onto the side of the nose. Good. Other side. chin. Marvelous. Could you look at me? Good. I'm going to put pressure on your eyebrows, okay? In 3, 2, 1. Pressure, pressure, pressure. Relax. Did that cause any sense of headache? Are you okay? Good. Going to put pressure on the other side of the sinuses now, okay? Pressure in 3, 2, 1. Pressure, pressure, pressure. And relax. You okay? Good. And now pressure on the chin. 3, 2, 1. Applying pressure. Perfect. And relax. And any sense of pain or headache? Yeah, good. Good. I'm gonna ask you to lift your eyebrows for me. Can you do that? Good. And relax them. And can you furrow your brows as if you were angry? Good. Perfect. Now, can you close one eye? Just close one eye. Good, and open it and close the other. Just close the eye and open it. Perfect. Now I'm going to ask you, can you give me a very cheesy smile? Good, and relax. And frown for me. Perfect. And relax. Perfect. That is a good assessment of your musculature with your face. Okay. Going to move on to the shoulders now and the arms, okay? I'm just going to tap right down your shoulders to see if your arms move. You ready? Let's go begin. Good movement, other side. Good movement. Now I'm going to test your arm. Please hand me your arm. Good. And good movement, relax. Good movement, relax in your hand. Good movement, perfect. Other side now. Just your movement right there. Good movement, perfect, relax. Good movement, relax, give me your hand. Perfect movement. I'm going to ask you just to shake my hand now, and it's not going to hurt me. I'm going to ask you to squeeze my hand as tight as possible, okay? Good. And 3, 2, 1, shake my hand. Perfect, and relax. And the other side now. Shake my hand. Perfect, and relax. So it looks like dexterity, muscularity, and reaction times are perfect, which is what we need to know for a common reaction test, especially for someone who's quite tired. Good. Now I'm going to test right at your knees, okay? And try not to lift your leg and hit me, okay? So just relax. 3, 2, 1. Perfect. Other side. 3, 2, 1. Perfect reaction. And now I'm going to try just at the ankle, okay? Good. And just relax. 3, 2, 1. Good. And the other side. 3, 2, 1. Perfect. And if it's possible, can you move your fingers for me like this? Good. Can I see your hand? Good. I'm going to flip the hand now. Perfect. Other hand. And flip the hand. Perfect. And are you able to move your feet and your toes? Okay. Please do. Perfect. It looks like all of the movement is working great. You can relax now. Good. So it does look like your generalized health is okay and functioning properly. We have one last test here, which is just a quick test of your memory. Could you let me know what day it is? Okay, and what time do you think it is? Okay, and just looking at some of your x-rays here. Just taking a look. It looks like all of your bones look good and you look quite healthy. Yes. Now, could you let me know what was the last meal you remember eating? Okay, and do you remember the last time that you drank a glass of water? Okay, so it has been a while. I'm going to write that down so that we can assess that for later. Okay, and just a couple of memory questions, okay? What is 2 plus 2? 4, perfect. What's 5 plus 5? 10, marvelous. What's 10 minus 5? Perfect. And what is 4 plus 3? 7, marvelous. Good, it looks like your brain is functioning well, which is perfect. Thank you. I'm writing that down. Now I'm going to be sending your analysis right to the sleep clinic, where we are going to be seeing you next, okay? So it does look like you are experiencing just a bit of tiredness, especially with a little bit of delay. And that's okay, especially for someone who has been experiencing just a bit of feeling a bit unwell. Okay, I'm going to check up on you one more time in the morning, then we are going to send you to some appointments at the sleep clinic here at Dream City Clinic, and then we will see you in the sleep clinic, okay? I'm going to attach this sensor to your finger so we can monitor your sleep patterns, okay? Just hand me one hand. Perfect. And the other side. Good. And we are going to assess your sleep from now on your health, okay? Perfect. I will check up on you soon one more time in the morning. Just relax and enjoy the rest of your sleep. Perfect. Again, I am Nurse Luna. If you need me, there's a button to the side. Perfect. Cheers and have a good rest of your sleep. Marvelous.